It's a great time to be in the Indiana University Department of Surgery. We've got incredible things going on. We're at the largest medical school in the country. We're building a brand new campus that includes a brand new hospital as well as a new medical school building. I'm excited about the trajectory that the department is on. We're really moving forward in building our research programs, both on the laboratory side and on the health services and outcomes research side. We continue to build innovative clinical programs that serve the patients of Indiana and offer great opportunities for our trainees.
The clinical training here, I feel like it's something that you're not going to get in a lot of places across the country. Like Indiana University is the only surgical academic program in the state of Indiana. Now you think of a lot of programs in Chicago, New York, they're sharing all that patient volume and diversity with all these other institutions within a city, but you get the entire state and the entire state's diversity of patient care at Indiana University. And I think that makes this an amazing place to train for that reason.
But I think every single population that you interact with at these hospitals is extremely different and nuanced, and having that in your arsenal of skill building and interacting with patients in these hospitals makes you better equipped when you finally reach that chief year to execute care decisions on your own.
At Indiana University, we have a focus on innovation in education just because it's so important. We use technology at the max to assist that learning process. Simulation is the best example, but we also have innovation. We do a number of projects with improving non-technical skill, teaching them how to be good leaders, how to be good team members, and how to collaborate among themselves. In addition to this, we incorporate mental skills training, which is essentially teaching them how to perform under stressful conditions and how to optimize their performance no matter what condition they're in. And so the focus is, again, the learner. But all the innovation we are working on is how to enhance their experience, their learning, and really, in the end, their performance for when they're ready to do the best for their patients.
I really wanted to pursue educational research and a master's in health professions education. And so I wanted someplace that had a fellowship that was nationally known, was going to have a really robust program. I've gotten really plugged in with a lot of national leadership and organizations and education, and wouldn't have had that opportunity if I hadn't have been here and the relationships that I've made with faculty here.
So the major aspect in science for us is we have to be collegial. We are not an ego-driven institution where we can communicate with each other and express our views openly. So that kind of collaborative atmosphere is the critical component of how we are successful as a scientist and how we move the field forward.
Right, so I would say there's 4 basic opportunities that we have for students and residents who are interested in pursuing research. The first would be the Surgical Outcomes and Quality Improvement Center. It's a group of about 60 faculty members and analysts who really look into improving outcomes of our patients and the surgical experience that they have.
We've recruited many renowned faculty from across the country to join SOQIC and build our programs. Our goal is to build a cadre of researchers who can continue to do this work in the future.
The second opportunity would be with our Center for Surgical Sciences, which is a group of basic and translational scientists who are really looking to develop cutting-edge technology and biomedical research to really impact patients in terms of their care down the line. Surgical education is a hot topic that's really become very popular over the last 5 years or so here at Indiana, and that's an opportunity where we can build future program directors and future chairs to lead surgical departments in the future. And then lastly, I would say a great opportunity is our global health experience and the research that goes with that. We have a great relationship with Moi Hospital in Kenya. That's an opportunity where residents and students can actually go overseas and participate in research projects and care of patients over there.
IU really tailors the experience of your training in those research years to what you want to do and hope to achieve. And that flexibility and desire to incorporate my interests in pediatric surgery, education, and global health is something that was very achievable and palpable here.
A huge part of any physician's success is being nurtured, right? It's important to us at IU to not only teach the medical knowledge, but also to make sure that we educate each individual as a whole person incorporating all of their personal needs as well. So we have the ability to foster all those different avenues of interest in addition to just typical surgical training.
For example, I'm getting a master's in surgical illustration. So I could directly incorporate art into my career as a surgeon. So I think that's a good example of how IU tailors to individuals and helps you to maintain those things that keep you unique and keep you happy.
The department offers multiple opportunities for wellness. People have gotten married, they've had children, and so the department is very supportive in that regard. During our clinical time as well, the department typically hosts wellness events, and that gives us an opportunity for us residents to get together.
I really wanted to go someplace where the residents felt like home, and I cannot tell you how much at home I feel, even as an intern. Like, I moved from California to Virginia, and I don't think I felt at home as much as I do here in the Midwest at IU.
The diversity in the city of Indianapolis is amazing. We have sports teams, we have the Indy race car track, there's many music festivals. The cost of living is low. As a resident, you can buy a home, so I have a house, which is amazing. It's a great place to live, a great place to raise a family.
This department has been very intentional in terms of its growth over the last 5 to 10 years, where we are today and where we plan to go. From a research standpoint, we have increased our NIH funding over the last 5 to 10 years. Our education division has always been very strong, and we continue to provide excellent education while making sure we're at the cutting edge of what is best for our surgery residents. From a clinical aspect, we benefit from seeing lots of patients and lots of complicated patients. And we know that that is a strong point for our residency program. We're very uniquely situated in the center of Indiana, in a growing city, in a growing campus, a brand new hospital. And so I think all of those things we're able to provide for people who are coming here.
Join us. Together, we're shaping the future of surgery.